we start to talk about the arteries of the upper limb, we must consider the fact that the upper limb is rather very important in the locomotion, so it would require a lot of arterial, let's say, oxygenated blood supply, and for that matter,
classification. So we'll see about which arteries are proximal, or let's say in the immediate or direct contact of the first rib, or let's say lateral margin of the first rib, or pectoralis minor, how close they are. So the first classification would be anterior to the, anterior means in the front to the pectoralis minor. We say axillary artery. Now for the second part, we'll see the posterior, or let's say back part of the pectoralis minor, the arteries which are responsible to supply all of the structures found in the back region or the dorsal region of the pectoralis minor muscle. We have already seen that that's the basis of classification of upper limb arteries, so we're not going to leave out pectoralis minor at any point, because that would classify, that would indicate the naming also. First part would be the branch to the thorax and the acromion. Now thorax is the part where we have all of our mediastinum, all of our lungs and the heart situated. That's called thorax or thoracic part. Acromion is the process, or let's say acromion is a structure found in the scapula. Scapula is a bone in the posterior part of pectoralis minor. Now it's a very important branch, so it will give off its sub branches, and we'll see in the next part. But the scapula is not satisfied with the arterial supply of only one artery, because there are so many relevant structures and even the nervous plexus found in the scapular region, so we need many arteries. And also there we have seen internal thoracic artery, but it's entirely different. We are talking in the sideways, or let's say lateral region, so we'll say here only about the lateral thoracic artery. In the region that is down to the scapula, or below the scapula, we have an arterial branch called subscapular branch. Now subscapular branch will be divided into 4 small branches. When we start to talk about the subscapular branches, or the branches in the lower region or below the scapula, we definitely see that the thorax, or the region where the lung and the heart and all of the mediastinum is situated in the front. In the back we have the vertebral column, so it would require some supply to the back of the thorax. That's why it's called thoracodorsal branch. Dorsal means back and thorax is the region, so in the back of the thorax would be thoracodorsal branch. Now it's not only requiring thoracodorsal branch, because there are important structures below the scapula, but they are in the front, not definitely in the front, but in the sideways front, let's say in the lateral and anterior aspect. So for that matter, we will require something called an artery, which is originating in the back, but it makes a circle and it goes in the front. So it will have something called a circumflex scapular branch, or let's say in a half circle, which originates in the below scapular region, and it goes to the anterior region to supply the relevant structures in the upper limb, such as the round muscles or the teres muscles seen up to the clavicular branch. But as we move forward, we will definitely see that the acromion process requires its own nutrients and the supply of calcium, so as to maintain the bone density. So there would be definitely a small arterial branch to the acromion process itself, and there's a big muscle called pectoralis, and pectoralis muscles have 2 branches. One is smaller pectoralis and one is larger, quite larger. They are the muscles which do contain all of our chest region and the protection of superficial, or let's say apical part, the first lobe of our lung. is ensured by the pectoralis muscles. And as we have seen that they are classified as the origin from the lateral rib, let's say the lateral part of the first rib. So we will definitely see that on the lateral part there is smaller branch of the pectoralis muscle which is called pectoralis minor, and the arterial supply of pectoralis minor would be ensured by the thoracoacromial branch, which will give an arterial to that. Now we have seen definitely thoracoacromial branch, and we also saw the lateral thoracic artery, which would be responsible to supply all the relevant structures and also the ribs and the laterales, and let's say the lateral facet of the ribs of the thorax itself, because they require nutrients and the calcium supply also, so as not to get resorbed in the process. And that's why we call them posterior to the, we have a muscle that is the basis of classification, that is called pectoralis muscle and pectoralis minor, because it's smaller and it's in the lateral side. Now the pectoralis major in the anterior and this bigger muscle, so we are not talking about that because it would be in thorax proper muscle. So when we talk about the posterior part, we have seen the lateral thoracic artery. Now when we see the posterior part and the anterior part, we have seen axillary artery, and we also see internal thoracic artery, thoracoacromial artery. But we also have to talk about something which is down, or let's say inferior or below the pectoralis minor muscle, because there are structures below the pectoralis minor muscles which are quite relevant, so as to mention all the ribs from the fourth rib to the ninth rib, and they are pretty important, very important. The lateral margin of, or let's say lateral facet of ribs would be supplied by these arteries only. So when we talk about the inferior and lateral aspect of the pectoralis minor muscle, we see some of the branches which are not exactly as, they should not be classified in the upper limb arteries, but they are, because that's where the origin are, and there are smaller branches, however important, very important. We definitely see four important branches. First is below the scapula, so it's called subscapular. Now there are two very interesting branches coming off of one artery only, and it makes a circle. We have seen that some of the structures which are originating in the back but they terminate in the front, so we need an arterial supply which makes a curvature, let's say circle, so we call them circumflex arteries. So we have two of the very important circumflex arteries called anterior circumflex and posterior circumflex.